Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Joining us this morning is Allison London Brown, CEO of UVision360 Incorporated in North Carolina. She's joining us on the program to talk about Luminelle DTx Hysteroscopy System. Welcome to Health Professional Radio, Allison London Brown.
Thank you, Neil. I'm excited to talk to you today about UVision and what we're doing.
Give us a little insight into yourself. Who is Allison Brown, and what is it that you like to do, and what is UVision360's vision?
So my background is 25 years, surprisingly, I don't feel that old, in the healthcare space. I was with Johnson & Johnson for about 10 years, really focused a lot of my attention on women's health. So I've been in this market for quite a few years and really have seen the changes that have happened with women's health, both positive and negative, in terms of how women can be treated. And that's one reason why we're really focused on the office space. So as you may not know, a lot of these procedures can be done in the office. Surprisingly, we're talking about many hysteroscopy and cystoscopy procedures are 10 to 15 minutes long, and they may only require just a little bit of anesthesia, maybe a topical. It really does depend on women's ability for pain tolerance and also what the procedure is going to be. But we're talking about anything from abnormal uterine bleeding to long-term UTIs that people may have. So it's a wide range of diagnoses that these doctors may be looking to diagnose and treat. So I have been a part of UVision360. We're going on 5 years as a company. We hope to be one of those overnight 5-year sensations that everybody talks about.
Yeah.
So we are really focused on providing a better way for women to be treated in the comfort of their doctor's office. And specifically, we are working on some touchy subjects, which are the uterus and the bladder. And what we're looking to do, our vision has been to develop a system that allows physicians to go inside the bladder and the uterus, both from a diagnostic perspective as well as a therapeutic perspective at a much lower cost. So our system costs a lot less than other systems on the market, but provides the same great visualization. We've kind of stripped it all down. We don't have a whole lot of bells and whistles on the system because we want it to be really easy for anyone in their office to quickly employ this to use on their patients. And it's everything from taking biopsies with instrumentation, doing diagnostics to see if there are precancerous or cells that look suspicious, just taking a general look, looking at fibroids, polyps, et cetera. And then on the cystoscopy side, we're really interested in SUI or OAB. So if you're having a Botox injection or if you're having a biopsy in your bladder, and interestingly enough, we're also expanding to male urology. So we're really looking at how we really focus on that office practice with a cost-effective and a really clinically relevant product, especially at this time.
You mentioned some very technical-sounding procedures. You said office setting. All of these can be performed in the office. Traditionally, where have these procedures been performed? Today,
about 70% of hysteroscopies are done in the OR. But interestingly, with COVID, we've seen a migration and that transition to the office that we have been hoping for many years. And a couple of years ago, reimbursement really improved for an office procedure, which was very attractive for many practices to really start looking at whether or not they need to be moving their procedures to the office. So really all it takes is a very good system. They have to be able to see what they're doing. This is no different than the type of procedures they'd be doing in the OR. They have to have staff that is trained, and our team does that work to train them very quickly. And then they're off to the races, and they can really help to give better access to their patients by doing this. Again, many of these procedures, while they used to be done in the OR, they are now considered elective, which, Neil, is sad to me that, some of these kind of life-changing procedures are considered elective. And so, that's part of our mission too, which is to make women aware that they have a right to ask for things that can improve their health, not just their quality of health, but their actual health. And so it's been exciting to see people start to look at these systems and to really move. Again, COVID helped us because COVID said, these are elective, you can't do them in the OR. And so physicians said, aha, but I can do them in my office. I can bill for them. Patients actually prefer them. In all the studies we've seen, about 96% of patients prefer them in the office, and they would come back to the office for these types of procedures. So it's pretty exciting, even in a time of challenge, to see really good things happening.
Luminelle DTx Hysteroscopy System. You said many of these procedures now can be done in the office. I'm assuming that there are systems other than yours that physicians are using. How does Luminelle differentiate itself from current systems that are office friendly?
Luminelle is a modular system. And so what does that mean? We have a reusable scope. It's an endoscope. It's very small. It's less than 2 millimeters in diameter. And so physicians, again, can use this with cystoscopy, both female and male, as well as hysteroscopy. And what is different is we have this reusable scope, and then we have a variety of attachments that are called sheaths. And those sheaths allow you to do a diagnostic procedure, a flexible and a rigid operative procedure using 5 French instruments. But most excitingly, we will be offering the first of its kind biopsy sheath this summer. And that biopsy is allowing a physician to actually visually see the type of tissue that they want to take, and then they can watch it being taken via our sheath. So we have IP that protects us on this, but it is the first and only true visually directed biopsy sheath that is attached to a scope. It doesn't require any other instrumentation for a physician, and it allows a very quick biopsy. They can do both directed biopsy, which is looking at a spot and taking just that tissue, or what's called a global endometrial biopsy, which is really just taking tissue around the uterus. That can also be done in the bladder. So, it's very exciting to see this thing happen and what we're seeing.
Has the Luminelle DTx system been cleared by the FDA yet?
The system and our current diagnostic and operative sheaths are available today. And we have a partnership with Olympus in the U.S. So our system is available through Olympus in the U.S., but the biopsy sheath will be available through UVision and Luminelle this summer sometime, depending on when the FDA approves it. So that's the one we're waiting for, and we're very excited about that.
Well, our listeners would love to learn more about UVision360 and the technology that you're developing there. Where can we go online and get much more information?
Sure. So our website is Luminelle360.com. That's Luminelle, and then the numbers 360.com. Very easy. We have educational materials on there. We've done a series of webinars. There's reimbursement information if you're interested on RVUs. So there's a lot of information for practices and office staff on our website. So all of the information on the product is now on the Luminelle 360 website. So we're transitioning everything over to that.
Well, Allison, I appreciate you joining us here on Health Professional Radio. Lots of great information. Thank you for joining us.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Allison London Brown, CEO of UVision360 Incorporated. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.